My name is Michelle Johnson, and my topic for a pharmacology issue is one that I expect to see a lot of in my career as a pharmacist: antibiotic resistance. Antibiotic resistance is when diseases are no longer able to be treated by antibiotics that used to stop them. Antibiotic resistance is a serious threat to the world, and without proper education about it, the threat will only get larger. The word antibiotics comes from the English word anti and the Greek word bios, meaning life, essentially anti-life medicine. They take the life away from bacteria. Everyone knows when they get sick, if they can just get their hands on some antibiotics, they'll feel better. The antibiotics go into the body, find the pathogen, and either destroy it or denature it so that the body can recover. They're created from microorganisms naturally found in soil or fungi, or by chemical synthesis in a lab. There are many antibiotics available to treat people when they're sick. Doctors assess the patient, sometimes they run tests, and prescribe antibiotics known to help. Some of the most recognizable ones are Cipro, Bactrim, and penicillin. Without antibiotics, people would have a greater chance of dying from diseases. Take, for instance, coronavirus. People are dying at alarming rates, partly because there is no known treatment for it. But what happens when the microorganisms we fight with antibiotics start to fight back? All of a sudden, we have antibiotic-resistant bacteria to deal with. Sometimes they call these superbugs, which is just as scary as it sounds. The first antibiotic was discovered by Alexander Fleming in 1928. It was released in 1941, and the very next year, the penicillin-resistant germ, Staphylococcus aureus, better known as staph infection, was identified. When new resistant germs are discovered, scientists must work harder to find a new treatment. Sometimes it takes years for resistance to develop, like with amphotericin, which took over 50 years. Sometimes it happens within the same year, like methicillin. On the CDC chart, staph infection alone shows up as a resistant germ 4 times. It's resistant to penicillin, vancomycin, methicillin, and daptomycin. This list isn't even all-inclusive. There are many more resistant bacteria out there. This is just examples. Antibiotic resistance can affect everyone and everything. If the person, or even the animal, can be prescribed an antibiotic for it, then they have a risk of developing a resistant form of an ailment. Not only can a person develop a resistant disease, they can spread that exact disease to members of their households and communities. They can also be spread between people and animals, like salmonella, or from the environment, like mold. People with underlying health conditions, such as cancer or AIDS, or even transplant patients who have to take immunosuppressant medicines to keep their body from rejecting the organs that were put in, will undoubtedly be impacted health-wise more than the average person, but we're all still at risk. Antibiotic resistance can start in different ways. Just like people, germs have genes, and sometimes genes mutate. They can mutate on their own or in response to their environment. If the gene's germs sense a change in environment, like antibiotic presence, they can make changes or mutations to their makeup to better adapt to their environment. If a patient is prescribed an antibiotic therapy lasting for 7 days, but the patient starts feeling better after 3 days and stops taking the antibiotic, the bacteria may still be present, but in smaller numbers. Those smaller numbers can adapt to the traces of antibiotic in their environment and become resistant. That's why it is so important to finish a full course of therapy when prescribed. Overuse or misuse can also cause resistance. The CDC estimates roughly 47 million therapies are prescribed annually to treat infections such as cold and flu. Those can be overcome with over-the-counter treatments and just time. Like, your body has natural defenses to fight off that stuff. Overprescribing or unnecessary prescribing of antibiotics can cause bacteria to become resistant to common antibiotics, or wipe out the good bacteria in your body and cause even more problems because it gives the bad bacteria free rein to do pretty much whatever it wants and cause any kind of disease that it can think of. Communities can be severely impacted by antibiotic-resistant germs. They enable the spread of diseases that can be near impossible to treat. People most at risk are usually immunocompromised people, the elderly, and babies. A good example of this would be coronavirus. There is no known treatment right now. They just treat the symptoms, and everyone is affected by it. Even if you don't have it, or you don't know someone who has it, you've been affected. Entire towns and states have shut down. It has affected jobs, schools, and everyone's free time because we're all stuck at home. A lot of people who have died have been immunocompromised or elderly. Their bodies just don't have the required resources to get them over the illness, no matter how many of the symptoms are treated. Immunocompromised people count on their communities to control the spread of infectious diseases, especially the antibiotic-resistant ones, sometimes called superbugs. Every continent has some form of antibiotic-resistant bacteria, including Antarctica. Humans have even spread resistance to the penguins because they've found resistant bacteria in their guts. Hospital ICUs are also a big part of the resistance location based on just the sheer number of infections that they deal with on a regular basis. Preventing and controlling antibiotic resistance is important. The World Health Organization has many suggestions that people can do to stop the spread. Individuals can do their part by finishing a full therapy of antibiotics when prescribed, not insisting on antibiotics for every single problem, and practice good hygiene to prevent infections. Healthcare workers can help by frequently cleaning the rooms in between patients, instruments, and hands to stop the spread from one patient to the next, by only prescribing antibiotics when necessary, and emphasizing the importance of finishing a full course of antibiotics and not just stopping when they feel better. Thank you for listening to my presentation, and I hope you learned something that you didn't already know about drug resistance. This is a problem that will never go away, but it could be slowed down if enough people tried.